Hello, everyone. My name is Annie Scully, and I'm here with my colleague, Alana Kroger, and we're here to talk to you about 211 and tell you a little bit about who we are and what we do. 211 is a free, confidential information and referral service that connects people to essential health and human services 24 hours a day, 7 days a week, either online or over the phone. In Connecticut, 211 is operated by United Way of Connecticut, and in 1999, Connecticut became the first state to use 211 statewide. 211 seeks to meet the needs of every Connecticut resident by providing information, education, and connection to services. Our 211 contact specialists field phone calls from individuals across the state to help address immediate needs and find resources and services that will help meet families' and individual needs. Our continuously updated database includes more than 40,000 programs and services for more than 4,000 agencies and is maintained by 5 full-time resource specialists. Additionally, we offer more than 450 e-library papers, which are quick, just-the-facts papers on timely topics. United Way of Connecticut also operates several specialized services, including 211 Child Care, Care for Kids, the Child Development Info Line, Emergency Mobile Psychiatric Services for Youth and Adolescents, the 211 Housing Program, our 211 Navigator, and 211 Chat, which is operated Monday through Friday between 9 a.m. and 3 p.m.
Great, thanks Annie. I'm going to spend a couple minutes now talking to you a little bit about the 211 website, which can be visited at 211ct.org. We recently redid the 211 website so that it has a new look and feel, a new search engine of our database, and is mobile friendly so that it has full functionality on any device you're using. Below you'll see a list of some of the new and improved website features that we're most proud of. To give you a quick overview of how the search works, when you're on the home page, you're going to type a keyword into the search box. So this is going to be a word or a short phrase that describes the need that you have or the service that you're looking for. Alternatively, you can type a program name or an agency name in that box if you know which specific program or agency you're looking for. Down below, you're going to type a location into the location field. This can be a town, like Stamford, a zip code, like 06904, or even better, a specific address, like 100 South Main Street, Stamford. You're going to click the search button, and you're going to get your list of search results back. These search results are going to be ordered by proximity to the location that you searched. You have a large list of search results. You may want to use the advanced filters to filter down that list to a more manageable size. You can filter based on day of the week. So for example, if you need to find a food pantry that's open on a Tuesday because you have a patient that doesn't work on a Tuesday, you could do that. You can filter based on gender, age group, or radius if you only want to look at programs within 1 mile or 5 miles of the location you searched. This is particularly helpful for patients that might be walking or using public transportation to access services. Your search results list is going to give you, basic search results cards with general information. And if you're on a mobile device, you're going to have options on those search results cards to call the program, view the program's website, or get walking, public transit, or driving directions. You'll click on the More Details button if you want to view the full program record. That's going to have the description of the program, eligibility information, phone and fax numbers, application process, and languages offered. And then you can click the Share button if you want to share that program record via email, text, or print it out to hand someone a hard copy. Additionally, you can use the Add to Cart function on each card to begin to build a personalized resource cart for a client or patient, where you can add multiple programs across multiple needs to that personalized resource cart, print it out, or share it via email. We've talked to you a little bit about how to use 211ct.org to help your patients. Here are some additional ways to utilize 211. Of course, refer your patients to us. Let them know that they can dial 211 from any phone in Connecticut and get connected to our call center 24 hours a day, 7 days a week. In addition to connecting folks to community resources, we're also a crisis intervention hotline. You can visit our real-time dashboard of community needs data at ct.211counts.org. You can add or update program listings in our 211 database via the link provided. And you can help us raise awareness about 211 by sharing our 2-minute promotional video on waiting room TVs or at other patient access points. Lastly, we're going to leave you with our contact information. We hope that you'll reach out to us with any questions, and if you'd like more detailed training or presentations on any 211 program, service, or the 211 website. Thank you so much for your time today.